crap, my shirt ripped. Oh well. Okay. The reason you take your medications continuously and you do not stop them abruptly, and this goes in particular with, psychiatric medications and just a variety of just medications you take for other medical reasons. The only time you would stop medications abruptly is by talking to your healthcare provider, first off. Because if you've been taking medications for, an extended amount of time, and let's take for an example, even for this psych medication, okay? If you've been taking, for example, an antidepressant, let's just throw out an SSRI for 4 or 5 months, or let's say you've been taking it for multiple years and you feel like it's not effective anymore, there's side effects going on, and you're just like, I'm done with it, I don't think it's doing anything. There's a way to go about it. If you stopped it abruptly, for example, an SSRI, things, you can further develop chemical imbalances in your brain in regards to things such as serotonin, norepinephrine, and dopamine, to where you could unfortunately develop some tendencies which could cause things such as suicidal ideation. Also, on the other side, when you're talking about even non-psychiatric medications, a lot of times if you're stopping these abruptly, people don't think about it, but there can be psychiatric consequences from that as well, meaning mood changes, feeling just uneasy, extreme anxiety. And then there's even things such as anxiety medications like benzos and whatnot, to where if you stop that abruptly and you've been taking that for a while, you have a higher chance of developing seizures, in particular. And I would even say, even if you want to go down the route of let's say you drink, let's say you have alcohol use disorder and you drink daily. If you stop drinking abruptly without getting the help you need, things such as DTs, delirium tremens, can happen. I've got a video on that I can link in here for you, where you're feeling psychotic. There's psychosis. You have a bout of psychosis going on, which is a medical emergency. Also with that, again, things such as seizures can develop too. So the whole point to this quick video is just, if you're taking medications that you're wanting to get off of, there's a right way to get off of them. Never stop them abruptly. It doesn't even matter. Even something as simple as even a thyroid medication for low thyroid or a high thyroid. That's something, talk to your doctor about, even if you feel like there's no effect. Now, what I would say is too, obviously call your doctor right away, is if while you're taking it, you're developing adverse effects as well. Because with that, a lot of times, instead of just taking you off, they'll take you off of that abruptly and they'll substitute you something and they'll drop your dose drastically on that. So at least you're getting something in your system to where you don't have to go through a complete withdrawal from it. There are some medications you can, when you talk to a doctor, that you can stop, that they'll stop abruptly and they won't put you on anything else in the meantime. There are situations like that, but a lot of times just to minimize the potential risk of that, they will probably offer you something else in the meantime. Also, as well, with things such as I said, even anxiety medications, or even diabetic medications, even like, for example, metformin. A lot of times what patients will present with metformin, for example, let's throw that out there, a medication used for diabetes type 2, is a lot of stomach problems, causing a lot of diarrhea. That is very common, which is something at first that, as you start taking it and whatnot, your body will eventually adapt to it, to where that side effect will start lessening. And there's things that can help with that as well. But a lot of times it's like, you're put on something like, for example, metformin, you're having side effects from that. So you're like, oh, I've got to be put on another medication to fix that side effect, like the diarrhea. Then I got another one for the new medication I'm on. A lot of times, a lot of these side effects, the initial ones, if they're not life-threatening, try to write it out too. Because if you can write out some of these side effects at first, the body's great at adjusting, you won't need to be put on something else as well. So before starting a new medication, as well as, if you're trying to get off one, if you're going to be put on a new one, I know it can be kind of scary to look at all the different side effects that can happen, but truly everyone's body is different. Some people might respond to one medication with having GI problems. One person might have some headaches. Another person might even, just feel a little uneasy or some anxiety, not super high anxiety, but like just, it's a new medication. There's new you're feeling different. So the advice on that end would be, if you're not having things such as suicidal ideations, or you're not having things that are seriously causing concern. So if you're feeling completely distraught by starting something new, completely distraught, and you're like, something is seriously off, that's different. But if it's minimal side effects, like GI upset, stomach cramps, things like this that are managed, try to write it out for about a week, week and a half. And if it starts lessening, you don't have to worry about potentially going on another medication. So sometimes you just kind of have to ride the storm out at first. But that's if you're being started on a medication. But once again, if you're trying to get off of a medication as well, don't stop abruptly unless directed by the doctor. And also with that, I'll just say this too. For example, here's another one. For something like prednisone, make sure that if you're taking a medication and you're getting off of it, if they tell you to taper, they should be explaining to you what a taper is. It's not just, once again, tapering is not stopping something abruptly. It's slowly reducing the dose. So for like prednisone, if you're put on it, let's say for me, for example, I talked about this a while back. A long time, this was in college, I got mono, really bad. I went to a minute clinic and they're like, oh, they just thought it was bronchitis. They didn't even run a mono test. I'm like, this is not bronchitis. I've had bronchitis numerous times. I feel a lot different. I can barely swallow. They're like, no. So I leave. Then I go to my primary care provider and they do a test and it's mono. They put me on prednisone for about 2 weeks. And over that last week, actually, sorry, I was on it for 2 weeks. Then I had a taper of a week. And I'm happy I did taper, because the thing that I noticed was, because for me, prednisone gives me a lot of energy. I feel like I can do a million things on it. That's one side effect of it. But when you go off of it, it can cause anxiety. You feel a lot more tired. And I'm happy I tapered and did it the right way, because if I wouldn't have, I feel like I probably would have felt pretty bad for like 3 or 4 days afterwards. So that's the point. Make sure with it that you are actually tapering. And also as well, if you need, talk to your doctor if you're worried about stopping something cold turkey or whatnot, because what's going to help for some people, everyone's different, but for a lot of people, going cold turkey compared to slowly going off something can be a lot easier for people. Like and subscribe. That's your daily dose of mental health. Take your medications. Talk to your providers.